Hi, my name is Wyatt Floyd. I'm a licensed independent Medicare broker with seniors on Medicare, and in this video, we're going to be breaking down the 4 parts of Medicare. Now, if you are looking for a more detailed video that explains how and when to enroll in Medicare and some of the choices that you'll need to make as you embark on your Medicare journey, I have a separate video that tells a little bit more about some of those topics. This video is meant to just focus on the 4 parts of Medicare, what their costs are, what they cover, and some other things to be aware of when making decisions about those 4 parts of Medicare. So let's go ahead and dive in. There are 4 parts of Medicare, and they are Part A, which covers your hospital insurance. It's primarily known as your inpatient insurance. There's Part B, which is your basic medical insurance. You can think of it as insurance that you use when you go to see the doctor for your regular doctor visits. Then there's Part C, which is known as Medicare Advantage, and it's an alternative to Original Medicare. Original Medicare is just Parts A and B. And then there's Part D, which is your prescription drug coverage. So stick with me, we're going to break down each of these in just a bit. So the first thing that we're going to talk about is Part A, which is your hospital insurance. And hospital insurance, or that Part A of Medicare, covers a variety of things. It covers your inpatient stays at the hospital, stays at skilled nursing facilities. It covers some nursing home care so long as it is not long-term or custodial care. It covers hospice and some home health care. In terms of your premium, so long as you or your current or even your former spouse have worked for 10 years or 40 quarters and paid Social Security taxes, then you qualify for what's known as premium-free Part A, which means that you do not have to pay anything from month to month to keep your Part A coverage, which is pretty nice. But there is a deductible, and the deductible for Part A works a little bit different than a lot of other insurance you may be used to. It's on a per spell of illness basis. So essentially the way it works is like this. If you go into the hospital for one illness, then you are going to pay your deductible amount before your Part A coverage kicks in. And in 2024, that deductible is $1,632. After that, your Part A coverage kicks in and you are using your Part A of Medicare insurance. Now, let's say that you leave the hospital and then you go back in for some new illness or injury. Well, your deductible resets, even if it's within the same year. And that's what that per spell of illness means. Now, even if you go into the hospital for the same condition, but you are out of the hospital for a period of time, that deductible may reset as well. So long as it's after a 60 consecutive day period of being out of the hospital, even if it's for that same illness, then your Part A deductible will reset. So that's important to know. So now let's talk about some of the Part A costs. So for your hospital inpatient stays, for days 1 through 60, you're going to pay $0 out of pocket after your deductible has been met. Once you get to days 61 through 90, then you'll be responsible for a $408 copay each day that you are in the hospital during that 61 to 90 day window. After that, you are in what is known as your lifetime reserve days, and these are days 91 through 150. So if you are in the hospital for 91 consecutive days, then you're starting to run into these days where you are going to pay $816 out of pocket for each day that you are in the hospital. And this is just for those days 91 through 150. Another thing that's important to note about these lifetime reserve days is that they do not re-up. So if you were in the hospital for, let's say, 95 days, and then you leave the hospital, you go back in another time, sometime later on in your life, and you're in for an extended period of time again, let's say 100 days to keep it a nice round number, then you've used up 15 of your lifetime reserve days. Now, you can probably do the math quickly to yourself. You have a total of 60. You use up 15, now you're left with only 45 for the remainder of your life. And also, if you use up all of those lifetime reserve days anytime you're in the hospital after 90 days, you're going to pay all costs. Don't worry though, if you're concerned about this, there are some additional coverage options available, both through Part C of Medicare as well as through some of those supplement plans that I mentioned earlier in this video. So there are some options available to you. Up next, we'll talk about skilled nursing for days 1 through 20. Again, it's going to be a $0 copay after your deductible has been met. Days 21 through 100, it's going to be $204 per day. And after day 100, you will pay all costs once again. And again, just note that anytime you see a $0 copay amount, that's going to be after you've already met your per spell of illness deductible. Up next is home health care. Again, $0 for covered services. And then there is a co-insurance amount that you're liable for, which is just 20% of the Medicare approved amount for a durable medical equipment. That's DME. It's stuff like wheelchairs, walkers, hospital beds. So if you're at home and you need some of those items, you'll be responsible for 20% of the cost of those things at the rate that Medicare sets. For as long as you use them at home. And then finally is hospice care. You'll pay $0 for covered services, and then a copay of up to $5 for each prescription drug and other similar pain relief or symptom control medications that you may take during that time. And then you'll also be responsible for 5% of the Medicare approved amount for any inpatient respite care. So those are your costs for Part A. Now we'll talk about Part B, which is what you can think of as your basic medical insurance. It covers a variety of things. It covers doctor's visits, preventative care. It covers some prescription drugs, outpatient surgery, meaning that you go into a hospital or other surgical facility and you are sent home that same day, diagnostic tests, home health care, hospice, and some of that durable medical equipment, your DMEs. The deductible for Part B works like a normal deductible. It is paid off once per year. And in 2024, the Part B deductible is $240 per year. Then you run into your premiums, and for most people, you're going to pay a $174.70 premium, though some will pay more, and that's going to be adjusted based on your income-related modified gross income. So here's this table that you can take a look at. I'll leave it on the screen for a moment. If you fall into one of these camps where you are, your modified adjusted gross income is this amount, then this is what your premium amount is going to be for Part B from month to month. So let's move on to your co-insurance. Again, for Part B, it's mostly going to be 20% for Medicare covered services. That's what you are liable for once you meet your deductible. So for clinical lab services, it's going to be $0 for covered services. Home health care, $0 for covered services, and then 20% of that co-insurance for your DME, that's durable medical equipment like wheelchairs, stuff like that. Inpatient hospital care. Now, I know you heard me say that Part A is your inpatient, but when you're in the hospital, sometimes you may see a doctor, a specialist, orthopedist, whoever it may be, and your Part B is actually going to cover some of those services. It's going to be a 20% co-insurance payment for you. For outpatient mental health care, it'll be $0 for a yearly depression screening, and then 20% for other visits to diagnose and treat your conditions. Just note that if you get your services in a hospital, you may have to pay an additional amount to the hospital for those services. For any partial hospitalization for mental health care, your co-insurance amounts, once again, 20%. And then for outpatient hospital care, it's usually 20%. And you'll also pay a co-payment to the hospital for each service you get in a hospital outpatient service. outpatient setting, except for some preventative services. But in most cases, your copayment won't be more than the Part A hospital stay deductible amount. So that is your Part B costs and coverage. Next, we'll talk about Part C, which is also known as Medicare Advantage. We're going to define it really quickly here and just really briefly touch on it, but we'll go into a lot more detail about some of the differences and pros and cons of going on Medicare Advantage versus going the traditional Medicare route later on in this video. So please check that section of this video out if you're considering this as an option. So what Medicare Advantage is an alternative to original Medicare, and it's offered by private insurance companies that are approved by Medicare. So if you do go the Advantage route, Medicare is no longer your primary insurer. Your primary insurer would be whichever Advantage company you go with. So Medicare is your primary insurer when you're on original Medicare. Whichever company you go with is your primary insurer when you're on Advantage. And that comes into play when you're considering different doctors to see and whether you're in network or out of network. We'll talk more on those differences later. But Part C plans must cover everything that's included in Parts A and B of Medicare, but also offer some additional benefits like vision, dental, and some prescription drug coverage. There are a variety of different types of Advantage plans out there, and your premiums and other costs like deductibles and co-payments are really going to vary depending on the plan that you choose. Now, with Medicare Advantage, these amounts can and will change from year to year. Also important to note is that you must have Part B and keep paying your Part B premium in order to stay on your Advantage plan. Once you select an Advantage plan, there are only a couple of times per year when you can make changes to your plan, and that's usually in the fall during the annual election period and then at the start of the year during open enrollment. Not going to talk a whole lot about that in this video, but just know that if you go the Advantage route, that's something you will need to pay attention to yearly because it can and will change yearly. All right, and last but not least is Part D of Medicare, which is your prescription drug coverage. So with Part D, it covers most outpatient prescription drugs. And similar to Part C of Medicare, it's offered through private companies, either as a standalone plan for those people who choose to enroll in just original Medicare, which is Parts A and B, or it's offered as a set of benefits that's included with your Medicare Advantage plan. So similar to enrolling in Part B or enrolling in Part C, you're going to have to do this on your own separately from your original Medicare enrollment. And unless you have what's called creditable drug coverage and are going to enroll in Part D at a later date, then you should enroll in Part D when you first become eligible for Medicare. If you delay your enrollment, you could face gaps in coverage and enrollment penalties that will last the lifetime of your coverage. So I'm sure a lot of you are wondering what that penalty is. Here it is. Medicare will calculate that penalty by multiplying 1% of whatever the national base beneficiary premium is, which is $34.70 in 2024, times the number of full uncovered months that you didn't have Part D coverage. And then that is going to be rounded to the nearest 10 cent and added to your Part D premium. And that's going to last the lifetime of your Part D coverage. So be sure to enroll in Part D when you enroll in Medicare, unless you do have that creditable drug coverage. And if you're wondering whether or not your coverage is creditable, then you can just give your current provider a call and they'll be able to tell you whether or not it is. And most are, but just be aware of that. So what Part D covers, again, really is going to vary by plan, but it mostly will depend on the drugs that you take, where you live, and the plan that you choose. So that's really going to influence the cost of your plan. Now, each Part D plan has a list of covered drugs called its formulary. And if the drug that you need is not on the formulary, you can make a request for an exception. You can pay out of pocket, or you can file an appeal to get that drug covered. But for the most part, when you're enrolling in Part D, you'll be able to type in the drugs that you are currently taking, and most of those drugs likely will be covered by one plan or another. So all Part D plans have to cover at least 2 drugs from most categories of types of drugs, and they have to cover all drugs that are available for these categories. So all drugs are covered for HIV or AIDS treatments, antidepressants, antipsychotics, anticonvulsive treatments for seizure disorders, immunosuppressive drugs, and anti-cancer drugs, unless those are already covered by Part B. Now, Part D plans must also cover most vaccines, except for any vaccines that are covered by Part B. And there is an exception to some drugs that will not be covered. So Medicare does not allow drugs that are used to treat weight loss or gain. It doesn't cover any over-the-counter drugs, and some others that are explicitly excluded by Medicare by law are not covered under any Part D plans. That's just the way that it is. So those are the things that are covered in Part D, and again, I can't really speak to the costs because it's mostly going to depend on the plan that you choose. So that's it for the 4 parts of Medicare. I hope that this video helped you. Again, if you need more information about how to enroll, when to enroll, if you're looking for some guidance and some of the choices that you'll have to make in deciding whether to go with the original Medicare route or going the Advantage route, I have another video that goes into more detail on those topics. Additionally, if you need help with making some of your Medicare choices or just understanding Medicare in general, please give us a call at Seniors on Medicare. Who we are is a small family business that's been in operation for the last 30 years. If you give us a call, you're going to talk to me, or you're going to talk to my business partner, who is my father-in-law. His name is Jim. He's amazing and a wealth of knowledge. But what we do is we provide people with guidance. We work with a number of insurance companies, whether it's a supplement plan, an Advantage plan, or a prescription drug plan. We can help you choose whatever is going to be best for your particular situation and your financial needs. And something that we do that's a little bit different than some of the other brokers out there is we offer free lifetime service. And what that means is that we continually monitor your plan with other plans that are available out there. So if there's something that gives you the same exact coverage but is at a better price, we'll let you know so you're never overpaying for your medical coverage. Again, thanks for sticking with me. I hope this was helpful. Do me a favor and drop a like on this video if it was helpful to you. And if you have questions, leave a comment and I will be sure to get back to you. Thanks again. Have a wonderful day, and may everything go your way in your Medicare journey. Thanks. Bye.